Today we're going to watch our physician assistant, Amira Al-Basha, perform lip injections on 3 different patients. Each patient has a varying lip size, lip shape, and desired goal. The first thing that we like to do is start with a topical numbing. So that topical numbing sits on for about 30 minutes to help make the process more comfortable. Then, like you can see here, majority of our patients opt in for the dental block. Performing a dental block actually makes the treatment much more comfortable, and some patients even describe it as essentially painless or as though they can't feel it. The dental block is essentially exactly what you think it is, just like going to the dentist, having them numb the mouth before they perform any work. So then Amira likes to actually test each region and quadrant of the lips to make sure the patient does not feel any discomfort and cannot feel the poking before she proceeds with treatment. We want our patients to be as comfortable as possible when receiving this treatment, especially because they're doing it mostly for cosmetic reasons and cosmetic concerns. So not all the time does beauty have to be pain. So then we are distributing some Juvederm Volbella into the patient's lips. Juvederm Volbella is a hyaluronic acid-based filler. It's a gel-like substance that works to restore volume loss and also hydrate certain areas such as the lips. We can also do fine lines above the lips. Sometimes we can treat scars with this product. What's so great about Juvederm Volbella is it's one of the thinner, softer formulas. So it provides a really juicy, hydrating, but soft, pillowy plush effect to the lips. We find that it looks very natural, and patients even feel that their lips are more natural to the touch. A little bit of pinpoint bleeding is to be expected as we are performing an injection. We do recommend avoiding any anti-inflammatories or blood thinning medications prior to treatment to help decrease that. Juvederm Volbella is typically sorted into a few smaller syringes so we can designate the product to specific regions of the lip. This allows us to make sure everything is distributed very evenly and we're not over or under using the filler in any specific area. This patient here is expecting an overall fuller look to her lips, but also a bit more border definition. We can see that there's a bit of swelling that occurs with the injection process since we do have to poke into the lip multiple times. The swelling is very normal and to be expected for at least 24 hours up to potentially a few days. Swelling can easily be resolved by sleeping slightly elevated and using a cold compress as needed. Bruising may also occur after any filler injection, which varies per patient, but we do find it is more common in the lip area in particular, as it is a bit more sensitive and has thinner skin. The bruising typically resolves in about a few days up to potentially 2 full weeks. So if you have any major events scheduled, we definitely recommend ensuring that your injection is scheduled within enough time to allow for full healing. A few fun facts while we're here about lip filler, and specifically using Juvederm Volbella. The product can always be built on. So if you do find that you only start with, say, maybe 1 syringe of filler, which is where we typically recommend starting, we can add more product as desired. So if you feel that you're looking for an even more drastic look or just a little bit of extra plump, we can always add more, whether that's a half syringe or another full syringe. We can assess at that 2-week evaluation and see where to go from there. Amira and all of our providers here at Edgebrook Dermatology aim to give you the best results possible. So sometimes it's better to start small and build on once the swelling has subsided. Moving on to patient number 2, you can see that before we actually start treatment, we do sanitize the area. We didn't see that with our last patient, but here is just kind of a walkthrough. We make sure that the area is completely clean. So even if you come with makeup, just know that we will be cleaning the area in order for us to make sure we provide a very safe and sanitary procedure. You can see the patient here receiving a bit of that numbing gel to prep for the dental block. We like to use this little buzzy device as it actually helps to distract from any discomfort or pain. Our patient is receiving her dental block, and then we are testing to make sure that she cannot feel anything. Overall, a filler injection typically takes about 30 minutes. When you include the topical numbing process, you're usually in our office for about an hour. It does depend on how many syringes are being injected and in which locations. If we're doing multiple syringes, consider each syringe to be an additional half an hour. Our providers are each very cautious, very particular, and attentive. They try to make their patients as comfortable as possible, but they also want to make sure that the results are beautiful and also that they are being safe and cautious with the placement. You'll also notice that Amira massages the lip area. So once the filler is injected into the lip, we like to smooth it out and make sure that it is evenly distributed and that there are no bumps or any areas that may look a little unnatural. Smoothing this out and massaging the lip during the injection process will make sure that everything looks very cohesive and works to provide the best result for you. And last but not least, patient number 3. This is a patient who actually currently has lip filler, but she is looking to build on specifically in the center of her lip. The patient actually has a very specific lip shape, and so it is a little bit trickier to provide volume into the very center of the lip. We can definitely aim to do this though by building our product in with very particular placement. This is a great example of the many different things that patients may be looking for with their lip filler and the many different things that we can actually accomplish with it. Lip filler does not just mean bigger lips. Sometimes it just means a little bit more plump in a specific region of the lips. Sometimes it means specifically border definition. And for some patients, it may even just be upper or lower lip. Another thing we can do is provide a touch of hydration to soften fine lines. So if patients feel that they're not necessarily looking for a significantly larger lip, but they just want to soften all of the fine lines and creases that they have on their lips and provide that kind of hydrated, almost glossy look, we can use a minimal amount for that as well. Filler has definitely had a bad rep over the last several years. And there's a lot of misinformation surrounding that, which is why we feel it's important to fully educate our patients on what these items are and what to truly expect of them. Majority of patients are actually very surprised once they can see and experience what injections can actually accomplish, and we always want to encourage patients to do what is going to make them more confident in themselves. Whether it's restoring your natural face shape or providing a touch of volume into areas that you never had it and have always desired it, fillers are so great, and we're so happy that over the last few years, the stigma surrounding filler has really broken down, and we are seeing breakthroughs with patients who are feeling more comfortable and confident than ever.